Diabetes Connections is brought to you by Dario Health. Manage your blood glucose levels, increase your possibilities. By Gevokaipo, the first premixed auto-injector for very low blood sugar. And by Dexcom. Take control of your diabetes and live life to the fullest with Dexcom.
This is Diabetes Connections with Stacey Simms.
This week, imagine being newly diagnosed and having to decide right away whether to take part in a clinical trial. The PROTECT trial is for kids and teens and needs to start within 6 weeks of diagnosis. Alex Lahners agreed to do it.
I know that I don't want future people getting diabetes, and I didn't want anyone I knew to get diabetes. So I ultimately was like, I'm not just going to do this for myself. I want to do this for other people who are in the future going to be diagnosed.
Alex is 16. He was diagnosed last year. He and his father talked to me about the decision to take part and what happens during this trial. In Tell Me Something Good, a big achievement for a kid I've never met but feel like I've known forever, one of the first families I found in the online community. This podcast is not intended as medical advice. If you have those kinds of questions, please contact your healthcare provider. Welcome to another week of the show. Always so glad to have you here. We aim to educate and inspire about diabetes with a focus on people who use insulin. My son Benny was diagnosed with type 1 right before he turned 2. That's 14 and a half years ago now. My husband lives with type 2 diabetes. I don't have diabetes. I have a background in broadcasting, and that is how you get the podcast. I told you a couple of weeks ago, I had a meetup. It was my first in-person parent meetup since COVID. I used to do these things all the time, and I've done them for years. I run a large parenting group here in the Charlotte, North Carolina area. And it felt so good to see people again and have these meetups. But what was amazing, and this is what I told you about, is that 2 of the families, newer diagnosed, already had their kids in clinical trials. And we live in Charlotte, which is not where a lot of these take place. So I was really impressed. And I think that obviously speaks to the access that we have. We have fabulous endocrinology groups, and we have really great outreach programs from JDRF here in our area. But I think it also speaks to the availability of these trials. These were not happening back when my son was diagnosed back in 2006. And I covered one of these trials, the one we're going to talk about today. I talked about this briefly in an episode a few weeks back with Dr. Henry Anholt from Provention, the group behind the PROTECT study. And here's what he told us at the time. If you missed that episode, I will link it up. But in a nutshell, the PROTECT study is involving about 300 children and adolescents. They're in clinics across the U.S., Canada, and Europe. You have to be 8 to 17 years old. You have to be diagnosed with type 1 diabetes in the previous 6 weeks. So as I said in the tease, it's really quick. You got to know you have it and get in here to the study really quickly. You have to be positive for 1 of 5 T1D autoantibodies. You have to produce a minimum of your own insulin. They do those 2 tests as part of the study, and then you need to be otherwise generally healthy. Kids in the study are placed into one of 2 treatment groups. 2/3 of the participants will get the actual medication here, and 1/3 will be assigned to the placebo group. It's decided at random. And the medication in this is decided at random, and it is blinded, which means nobody, not your child, not you, not the doctor, will know what group you are in. And the medication is going to sound familiar. It is teplizumab. This is the medication that we've been talking about for several years that is in many trials. It is in front of the FDA right now as a prevention for type 1 diabetes. It's been shown to prevent the onset for a couple of years. This is a little different though, right? This is using teplizumab in kids who are already diagnosed, seeing if they get it right away, what happens. So the Lahners family was kind enough to talk to us about their experience here. And I'm going to go ahead and sort of spoil the ending because I was amazed by this. Alex is Benny's age. He is 16. He is not a small kid, and he is using about 6 units of insulin a day. A day. If you're at all familiar with teenagers, it just sounds absurd. We would love to say, of course, just from that the study's a big success. The medication works, bring it on, of course, But look, they don't even know if he was actually in the part of the group that got the teplizumab. He could have gotten the placebo and I guess being a very long honeymoon, be a really exceptional case. I don't know. We will talk about it in just a moment. But first, Diabetes Connections is brought to you by Pen. Our endo always told us that if you use insulin, you need to have emergency glucagon on hand as well. Low blood sugars are one thing. We're usually able to treat those with fast-acting glucose tabs or juice. But a very low blood sugar can be very frightening, which is why I'm so glad there's a different option for emergency glucagon. It's Pen. Pen is pre-mixed and ready to go with no visible needle. You pull off the red cap and push the yellow end onto bare skin and hold it for 5 seconds. That's it. Find out more. Go to diabetes-connections.com and click on the Gvoke logo. Gvoke shouldn't be used in patients with pheochromocytoma or insulinoma. Visit gvokeglucagon.com/risk. Alex and Jeremy, welcome to the show. Thanks for joining me.
Thanks for having us.
I'm really excited to learn more about your story. You know, it's interesting, you're the same age as my son, but very different circumstances. Before we get to the studies and teplizumab and all that stuff, Jeremy, let me start with you. Tell me the diagnosis story. How did you know something was going on?
Well, it was a warm summer night, almost a year ago now. We had noticed over the course of really a couple of weeks that Alex just was not feeling well, and he's always done kind of a good job of hiding some of his symptoms from us a little bit. And he had just not been feeling well. He was drinking a lot of water and was sleeping a lot. Probably the sleeping was the thing that we noticed more than anything. He just wanted to sleep all the time. Now, school had just ended maybe a week or two prior to this. And a lot of what we saw as symptoms, we really chalked up to a teenage kid wanting to just be left alone now that school was done and wanting to sleep all the time. So we sort of wrote a lot of stuff off. We did take him in because he had indicated he had some symptoms kind of leading up to some of all of this. And our doctor at the time, based on the way that we described things, really thought that it was allergies. And so we started allergy medicine then. The day before we took him to the hospital, we just noticed that he was really looking thin. And he's a wrestler. He has lost weight over the course of the many years that he's been wrestling. And so we know what weight loss looks like for him. But this was very unusual weight loss. And so I actually asked him to weigh in that evening, and he had lost over the course of about a 4-week period, he had lost about 30 pounds. And as a 150-pound kid at the time, losing 20% of your body mass is a lot. The next morning he got up and he looked like a ghost. He was just real thin. And
Alex, do you remember how you felt?
I vividly remember all of this. I remember when it first started happening, like Dad said, I was drinking a ton of water, and it really just felt like my tongue was constantly sandpaper. Mm-hmm. And I would pour water into my mouth and it wouldn't go away. And I was just drinking so much water. I think my water intake like quadrupled or more. And it was really odd. I've never loved drinking water, but I think that was the first time I was like, oh my gosh, give me all the water I can have.
What did you think when you got on the scale? I mean, 30 pounds is extreme.
I knew that I was losing weight. I knew that I'd lost weight, and every sickness, sometimes you just lose weight. Yeah. But when I got on the scale, and I think it said I was at 134, and I had previously weighed in at like 160 something. Yeah, that's not right. And I remember weighing myself a second time just to make sure, and it came up with the same number. And I was like, I went downstairs and I told my dad, I was like, it says I'm 134. And we couldn't believe it. I remember everyone, like my mom, my dad, and I think maybe someone else who was there, we were all just like really shocked at how much weight I had lost.
Like I said, the next morning he woke up and just looked rail thin. And so we took him to the ER. We kind of had decided that was the line where something was clearly off. We didn't know what it was. They ran all of their tests, and probably within 20 minutes or so, they came back and said, we're not sure exactly what's going on, but by the way, your son is a diabetic. That could be the cause of things. Yeah, I mean, it was very kind of in passing a little bit. And I remember, this is all during COVID, so only one parent could be with him at the time. So I'm texting my wife, and I'm texting her. I said, they're saying that Alex has diabetes. And she says, there's zero chance of that. tell them to rerun tests because they have no idea what they're talking about. They came back in and said, yeah, his blood sugar is at 588. That's tremendously high. He's clearly diabetic. We think you should probably take care of this problem. They put us on an ambulance and drove us down to the pediatric hospital in Charlotte. And we spent 3 days in the ICU, and they were able to get his blood sugar recovered, of course. And it was just a massive, massive crash course in all things type 1 diabetes at that point.
I don't really have the opportunity often, Alex, to talk to, a newer diagnosed teenager who actually wants to talk about this stuff. So just have to ask you, how difficult was it? I assume in the hospital, they made you do your own shots and had you figure everything out. What was that like to give yourself the first injection?
Honestly, when you first get diagnosed, or at least when I got first diagnosed, I got really lucky because I had some people around me who I had known previously who were type 1 diabetic. I got extremely lucky with having resources to reach out to and people to talk to. I have always, at least previously to diabetes, I had always hated needles. Hated flu shots. I hated everything. But obviously, getting diagnosed with diabetes, you kind of have to learn to get over it. I just kind of put it in my arm and I was like, this is going to be a new reality for me. And I just accepted it. And I don't think I remember feeling any sort of way with how the injection felt or how it made me feel. I think it was just kind of like this is how it's going to be.
So you leave the hospital, you go back to trying to figure out how to do life now with diabetes. But your experience took a turn in that you pretty quickly got involved in a pretty cool clinical trial. Jeremy, how did you find out about the PROTECT study?
Well, we sort of jumped headfirst into things. The nurses at the hospital were outstanding and gave us all the wonderful material on JDRF. I reached out to our local JDRF contact to submit Alex's paperwork and material and whatnot. And of course, that put us on the mailing list of the various JDRF webinars and things that are going on. And we followed on Facebook, joined the Charlotte Type 1 Diabetes Parents Group, all those types of things. We sort of dove headfirst into all of those resources. Within maybe a week or so, I happened to see a webinar that was upcoming about this PROTECT study, and we thought, well, we should at least listen in. We weren't really convinced that it was a great idea at the time, but we figured we're in this now. We need to at least listen to what's happening in the space a little bit and try to participate. It was hard enough sort of coming to grips with all the things coming at us, but we really did want to try to educate ourselves on the various medical things that were going on. So that was what led us up to listening to the details of the PROTECT study.
So what was involved? Tell me, we haven't been involved in a clinical trial, much to my son's regret. He's always pushing me to get him in, and we just haven't been successful yet. After all these years, I keep trying. So can you share with us a little bit of the process? Because it's not a local study. Right back to Jeremy. But first, Diabetes Connections is brought to you by Dario Health. And one of the things that makes diabetes management difficult for us, that is very annoying to me and to Benny, it isn't actually the big picture stuff. It's all the little tasks adding up. Are you sick of running out of strips? Do you need some direction or encouragement going forward with your diabetes management? Would visibility into your trends help you on your wellness journey? The Dario Diabetes Success Plan offers all of that and more. No more waiting in line at the pharmacy. No more searching online for answers. No more wondering about how you're doing with your blood sugar levels. Find out more. Go to mydario.com/diabetes-connections. Now back to Jeremy as he starts to take us into their study experience. I had asked him about whether there was a local site. Was it a local study?
It's not. It is a nationwide study. However, the nearest facilities to us were far from local. I think our nearest facility is technically Atlanta, but we had the opportunity during the webinar. They were interviewing Dr. Haller out of the University of Florida, and he was describing this PROTECT study on teplizumab, and we thought it was a good study for Alex. The sort of entry criteria for the study, they were accepting children, kids under 17 years, if I remember correctly, who either were pre-diagnosis or had been diagnosed within the last 45 days. So that immediately qualified us. I reached out during the webinar using chat tools inside of Zoom to say, my son was just diagnosed. We'd like to learn more. And Dr. Holler reached out to us via email the next day. We had a Zoom call with just him a day or two later, and he talked to us in a lot more detail about how the study goes and provided some options for us. So that was all the sort of pre-work, if you will. From there, we did take a day or two and we sat down as a family and talked about whether it made sense for Alex to participate. Both my wife and I had participated in some medical research studies when we were in college. There was a paid program at our college that you could take participation in some of those programs. So we had a background in it. And I think we were both pretty encouraging of Alex to participate in the study. But, Alex was 15 at the time, and we felt he was old enough and mature enough that he should really make the decision. And so we did leave it up to him, maybe with some heavy encouragement, but nonetheless, it was his call at the end of the day, and we would have supported that.
Alex, how'd you make the decision? What were you thinking?
So the decision was really honestly hard for me at the time. I was still trying to get over just recently being diagnosed and trying to get everything under control just to understand what was happening to my body. Ultimately, it boiled down to not only had mom and dad done, trial before, they've done studies before, but I don't think anyone who has type 1 diabetes would tell you, oh yeah, you should go out and go get type 1 diabetes. It sucks. It really is not fun. I thought if I would have had someone else 50 years ago been able to prevent or tell me that I was going to get diabetes and have a drug to prevent the onset of diabetes, I would have taken it in a heartbeat. I would have done whatever it was. And I know that I don't want future people getting diabetes and anyone I knew to get diabetes. So I ultimately was like, I'm not just going to do this for myself. I want to do this for other people who are in the future going to be diagnosed or are going to be diagnosed later, I guess.
Yeah, that's really a wonderful sentiment. I mean, Jeremy, I don't need to tell you this. Alex, you're so well-spoken and really mature about all of this. So thank you very much for sharing that. We can be goofy later, I'm sure. So Jeremy, you fill out the forms or do whatever you need to do. What happened in this trial? This is not a survey. This is a Go to Florida, go to the hospital, get a treatment. Yeah. What happens?
We went down to Florida a couple days early so that Alex could get a COVID test. I think he was the first person in our family to get one of the touch your brain nose swabs. He really enjoyed that, I'm sure. And then we started the study. The study was, the first part of the infusion was 12 straight days of infusion. Generally, it was anywhere from 3 to 4 hours per day. We typically did that first thing in the morning. Thankfully, number one, Alex was out of school, so it didn't interrupt school. Number two, my job is flexible enough that I was able to fulfill my work duties in the afternoons and evenings. So it really all worked out for us, very much a perfect storm of good, if you will. But for 12 days straight, we did the study, the infusion, and that first 12 days was probably the roughest, simply because going in, you don't know, it's a blind study, so you don't know if you're getting the drug or not. You could be getting the placebo. So there's a lot of trepidation and a lot of, do I really want to go through all of this pain multiple times through if all I'm getting is the placebo? We really had a lot of conversation about, what's this going to look like in 6 months or a year? That was ultimately the study we did. Because of the nature of this drug, it is an immunosuppressive. So we did have to quarantine, especially, again, given it was the COVID times, we really had to quarantine. We spent a lot of time in the hotel room just hanging out. And like he does, Alex slept a lot. That was the 2 weeks that we spent down there.
Alex, was it painful at all? I mean, is it just, well, I say just, I mean, is it just an IV and the pain is just sometimes when you get an IV put in that hurts? Or is there more to it?
Honestly, it's really just the IV. They do a great job of like counting you down. Like they'll be like, all right, we're going to put the IV in, take a breath, 1, 2, 3, and then they'll put it in. I have never had problems with it hurting too much. I still like clench my fist and my jaw when they put it in because, I don't like needles, right. But it only lasts for maybe 10 seconds at the most. And it is really fast. And once it's in, everything else is super easy. They tape it to your arm so it doesn't move and there's no chance of it being pulled out. And they're just super careful when either the placebo or the teplizumab is injected into you. It just felt like there was cold, I would say water running through my body, and you get this salty taste in your mouth. But besides that, that's all I could notice.
Well, and I know, and Alex, as you mentioned, they're very careful, they're very good. And Jeremy, when you and I spoke previously, you really said that this was a top-notch staff. Let me just give you a moment to give them the kudos that you had already mentioned to me off air.
Sure. I can't go into the details of how good a crew they really are. As much as I love our primary endocrinologist, she does a wonderful job with us here in Charlotte. Having the opportunity to spend 12 straight days with an active scientist of the study of diabetes, good or bad, them sort of being locked in a room with us for a period of time while they administered the drug to Alex, it really gave us an opportunity as a newly diagnosed type 1 family to ask a lot of questions. For, like I said, 12 days straight, we had access to Dr. Haller and the other doctors, plus all of their nurses and assistants, some of whom also have type 1 diabetes. And we were just able to ask all of the questions that are just reeling around in our heads. And all of them had been through different experiences or had treated patients with different experiences. And they were just able to answer so many questions, so many of the fears that we had as parents, and I think fears on Alex's behalf as being a newly diagnosed patient were so easily allayed as a result of just being able to spend so much quality time with such good individuals.
What happened after this? You came home. I mean, I feel like I know the ending to the story, and you're spoiling a little bit in my introduction in that it doesn't seem like you got the placebo. It seems like things are working out, let's just say, very differently for Alex than for a typical teenager in the first year of his diabetes. Is that safe to say?
It is. And admittedly, we don't know for sure. One of the disadvantages of participating in the study when we did was there's still that honeymoon period that many kids go through. And so a lot of what we experienced very early on was still questioning, are we just seeing the effects of honeymoon or are we seeing the effects of this study drug? Because his insulin requirements have been very, very low. That really just continued. We would go back to Florida every 4 to 6 weeks and do blood draws and just a quick one-day blood draw to test absorption. So no more drug was ever injected. In fact, his next injection is coming up in about 6 weeks. But again, he seemed to stay in what we thought as new parents to be the honeymoon period. And even today, nearly a year later, that's still where we're at. We're still kind of in this wonderful period where his insulin requirements are insanely low from what I've heard from other parents.
Well, let's talk about that. Give me an example.
I currently have heard from my primary endocrinologist that a kid my size and just my age would probably take around 60 to 80 units a day, somewhere around there. I think I am currently sitting at total daily usage of like 6.4 units a day. So that's, a tenth.
I don't want to get too personal, but would you mind giving us approximate weight and height? I mean, you're 16 years old.
Oh, absolutely. I'm 16. I'm probably around 178 pounds right now, and I'm about 5'10". So generally speaking, I should be taking substantial more amounts of insulin than I am.
Right, not tiny.
No, he's not a small kid.
I'm not even sure what to ask Jeremy and Alex because without knowing the typical experience, I'm not quite sure, what to ask you in terms of, I'll put it this way. I'm stuttering around because I can't ask you what's the difference because you don't know. I mean, my son is 16. He's 215 and almost 6 feet tall, which is great for wrestlers. We know everything about your bodies. We know how big you are. We know how tall you are. We know what you weigh on a daily basis.
Oh, yeah.
But, and he probably uses definitely 80 units of insulin a day. I mean, it's just remarkable. So how do you treat it? I know you wear an insulin pump. Can you use it? I mean...
So I do use my insulin pump, but the good thing about my insulin pump is, and especially just the T-Slim in general, is it's all programmable and you can set it up by yourself. So I have to set my insulin crazy low and I have to make these crazy schedules because when I first got diagnosed, I think I was on a 1-to-5 ratio of units to carbs. Mm-hmm. And then I hit my honeymoon phase and my endo backed it off to 1-to-15. And I was like, oh yeah, this is awesome. And I remember I went out and I ate like a fast food burger and I took obviously like a third of the insulin that I'd normally take. And I was like, right. This is great. And then as time progressed, it just kept needing to be moved back because I would take too much insulin and I would go low. And I was constantly fighting lows. And I still have that problem today. So there was a time where I was at a 1-to-100 carb ratio, and I'm currently at a 1-to-80 carb ratio, and I have to space out when my pump gives me insulin, because if it gives me insulin, like a correction dose throughout the entire day, the amount of insulin that I need to correct is so low that my pump won't let me put it in. So I have to default to the smallest amount, which is like 0.100 units of insulin in order to correction me down to where I need to be.
That's your basal rate.
That's my basal.
Yeah. So his basal is 0.1 units. And I think right now you're on every other hour.
Yeah.
Every other hour getting.
Oh, so every other hour is a 0. So you go at like a 0.1 and then a 0.0.
Exactly.
Yeah.
That's amazing. I don't want to get too far ahead of everything here. And Alex, I hope this continues for you, indefinitely. But Jeremy, what is the goal of this study to see kind of how long they can extend this honeymoon or keep these insulin uses low? Or, what is the hope? Have they expressed it to you or do you kind of just take it, month by month?
What they described to us very early on was that some of their participants were seeing this honeymoon period effectively extend for 2 to 3, sometimes even up to 4 years. That was really kind of the goal when we started. As we looked at where Alex was in his sort of maturation process, we sort of thought, if Alex could get through high school and maybe well into college, still on the honeymoon period, that would be a wonderful experience for him. He'd still have the opportunity to do all of the sort of traditional things that you think of without necessarily significantly having to worry about his diagnosis. That was our mentality going in. I've heard suggestions that possibly there's maybe kind of a continuing dose that you can get over the course of, follow-on years, but that wasn't part of the study or anything that we did.
They are still looking for about 40 people for this study. This is for new onset folks with type 1. What would you say if somebody's listening, they found the podcast pretty quickly, and they're debating? Is this something that you all would do again? Because you said it, like I said, it's not as easy as you stay home and take a pill. This may involve travel. This definitely involves 2 weeks of time and a lot of pokes.
Yeah, I mean, looking back, if given the opportunity again, we would jump on it in a heartbeat. I would say anybody who has the opportunity and the ability to take the time to do this study, not just the drug itself, but again, the time with the doctors, the combination of those two things is nearly invaluable. So to me, there's no way that I would turn down that experience again, even if Alex would have gotten the placebo. I mean, ultimately, even if he would have gotten the placebo, he was still going to end up in the same condition, just sooner. So at the very least, the time that we got to spend with the doctors has paid for itself trillions of times over. I guess maybe the other thing that's worth noting is these are paid studies. So Alex got a little bit of money to spend on his car at turning 16. He got a little bit of money to spend towards that, mostly on gas. So there is some monetary value to it as well that's worth mentioning. But that wasn't our purpose by any means. It was really the drug and the opportunity to spend time with the doctors would be my two key selling points.
You don't have to go on the record with this question, but can I ask you how much it paid?
It paid, I believe it was right in the neighborhood of $75 per day a visit.
I mean, it wasn't $5,000.
No.
I want to be clear when people are, were thinking about it.
I wish.
Yeah.
Yeah. No doubt. That's a lot of gas.
Still spend it, but but yes, no, it's not quite that much, but it's valuable,
Absolutely.
Yeah. So we go back the end of July,
okay,
and that will be our next 2-week visit. We've had a couple of visits since then. About every 6 weeks or so, we take a 1-day trip to Florida just to do checkups, but otherwise. This will be the next big one. And then I think from there, if I remember correctly, I think our next visit is 6 months afterward.
All right, Alex, I have 2 non-study related questions for you.
Absolutely.
How do you keep your gear on when you wrestle? What do you do with your diabetes stuff?
Obviously, that was a really big thing when I first got diagnosed, and learning that you're going to have all this stuff stuck to the side of you. It was like, people are going to grab that when I wrestle. And especially at a high school level and at a varsity level, there is no holding back. If you have a knee brace or anything, people are just going to attack that. That's what I've learned throughout the 12 or 13 years that I've been wrestling. I just was like really worried at the start, but I learned that if I was able to at least keep it close and, tight enough in, and, obviously you wrestled well and got off the mat sooner, then you wouldn't have any problems. The way that I wrestle with my stuff is I have my Dexcom that's always on. I never take that off for any reason, never even take the transmitter out unless I'm changing the transmitter or changing my site. For my T-Slim, though, I just disconnect it and I'd put a stop in. I learned that the adhesive is just as good as the Dexcom adhesive. And if I kept it more on my torso, every once in a while, I'd put it on my legs. But if I kept it more on my torso, because the singlets are just so tight, it just kind of glues everything to you. And I never really had a problem. I think the biggest part was locations as to where you would want to put your stuff. Obviously, if I put it on like the back of my arm, that's a more high risk area because that's a very frequent place for people to grab while you're wrestling. So I would put it on the upper part of my thigh, kind of closer to my groin or upper groin, and I would just put it in there, and that's where I would leave it. When I'd put my singlet on, obviously I'd pull it up, but a big problem for me was riding. Like the singlet would ride up my leg, and I didn't want it to pull off. So sometimes I would just pull my singlet just barely above or right on the infusion site so that I could just keep it there. And if it did pull up, it wouldn't pull my site off.
Do you use anything to wrap it, or everything just kind of sticks okay because of your locations?
Generally, I only use like over patches. I use like the Dexcom ones, and I think we had some like aftermarket ones whenever the Dexcom ones would run out. Unless it was like on my arm or something of the sorts, I wouldn't wrap it. But if it was on my arm or I just didn't have any other choice and it was in a very vulnerable area or I felt like it was about to come off, I would always wrap it with just some like simple athletic gauze, and then I'd put some athletic tape around it, and that always seemed to hold it. I also have a little like sleeve that I use for swimming and I guess for sometimes athletics, and I just would slip that on over it. It was like a dry fit sleeve, and that worked perfectly too.
Now, we did wrap your leg the first couple of times, but really we found it wasn't necessary. So we sort of stopped doing that by the end of the season.
My second question for you was, tell me about the socks.
So with Dr. Holler, I learned that we have a very similar passion for extremely crazy socks. Because I wrestle, I love wearing weird socks because there's three things that you can really change to differentiate yourself from the rest of everyone. It's your singlet, your shoes, and your socks. when you're wrestling on a team or just for your school, there's set singlets. So the main biggest thing you can't get to change. You don't get to change it all.
Right.
And for shoes, there are some flashy shoes, but really sometimes they get extremely expensive if you're going to customize them. They're similar to basketball shoes. So I decided the cheaper option, and the only one that I really had left was socks. So I started a while ago just getting tons of weird socks and funny socks. I have, pizza socks. Right now I'm wearing these weird math socks that say 5 out of 4 people are bad at math. Stuff of the sorts. I walked it into the study for this 2-week study. And on the first day, I met with Dr. Holler, and he noticed my socks. I don't remember what socks I was wearing exactly, but he also showed me that he was wearing some funny diabetes socks. And from then on, we've just had this competition to outdo each other. Even when he's not in the room physically, with me, if there's a different endocrinologist in that day, he will send them pictures of his socks in order to show me, to try and one-up me. But I like to think that I'm ahead, and if he's listening, I want him to know I will be winning this sock battle.
I love it. Before I let you go, Jeremy, you have said, and I forgot to ask, you have said that while he uses so little insulin, you do, I guess, I don't know if I'm struggling because I was going to say this is a downside, and I guess it is. You guys have still struggled with low blood sugars. Is that something that you are still dealing with?
It is. The struggle that we run into right now is, again, because his settings are so low right now, it's very easy for him to go low. We don't struggle with highs too much at all. And even when he does go a little bit high, he comes back down very quickly. But seemingly every day, I would say almost every day, he has a slight low episode. And even overnight, we'll have to wake him up sometimes and say, hey, buddy, you're low, eat some sugar. And he'll groan at us and tell us that we're wrong. But nonetheless, that is probably the one downside that we have seen. And listen, we'll take that downside all day long, but that has been probably the one downside that we've struggled with a bit.
Well, Alex and Jeremy, thank you so much for joining me. It's great to talk to you. It was really interesting. It was really fun. And, thanks for spending so much time with me and my listeners.
Thank you, Stacey. This has been great.
And I really should say thank you as well for doing the study. These studies are so important. And Alex, as you said earlier in the interview, people who take the time to do this aren't necessarily helping themselves, but they are helping the people yet to come. So I would be remiss if I wasn't thanking you and thanking your family for taking the time and the effort and going through all of this. So I think I speak for all of my listeners when I say thank you so much for taking part in this study.
It's our pleasure.
You're listening to Diabetes Connections with Stacey Simms.
Much more information at diabetes-connections.com or in the show notes wherever you are listening. And they are still looking for kids for this study. So I will link up more information. If you know someone who has just been diagnosed, if somebody's maybe going through TrialNet or the JDRF testing for a sibling or another family member has type 1 and they want to find out if they have it. This is the kind of thing where they have to get in so early. It's really hard to find people. So they are still recruiting. It was amazing to talk to this family and find out what their experience was like because, 16 years old and using that little insulin really just makes you sit up a little bit straighter. I mean, that would make a very big difference. Gosh. All right, much more to come. And again, you can always go to the website or show notes to find the links, find the transcription, and share this with friends because you never know who might know somebody who could be in the trial. Coming up, we've got Tell Me Something Good. But first, Diabetes Connections is brought to you by Dexcom. And I get a lot of questions about Dexcom coverage for people on Medicare. And why not? It's not as though you stop needing a CGM the minute you turn 65. The good news is that the Dexcom G6 continuous glucose monitoring system is covered for Medicare patients who meet the coverage criteria. If you have either type 1 or type 2 diabetes and intensively manage insulin, you may be covered. To find out more about what that means and if you qualify, check out dexcom.com/G6-Medicare. I will link that up with this episode. You don't have to write it down. You are going to want to talk to your doctor. And you may even be able to get your Dexcom supplies at the pharmacy, saving time and money. Learn more. Again, it's dexcom.com/G6-Medicare. tell me something good this week. I was scrolling through Facebook, as one does, and a bunch of graduation pictures caught my eye. Now, this time of year, of course, there's so many beautiful prom and graduation pictures, and I'm so happy for all the kids. And, as my kids have gotten older, we've grown up with so many people who are now sharing their beautiful graduation and prom pictures. But I had to stop because Lorraine Sisto posted pictures of Caleb. Now, those of you who had kids diagnosed around the same time as I did or earlier, our kids were diagnosed like 2006, 2007, during the heyday of blogging. It had really just started. There weren't that many, but it was growing. And man, in the next couple of years, there were hundreds of diabetes blogs. And that's how so many of us met each other. And now, of course, there's thousands of Instagram accounts and social media stuff, and it's changed and it's still great to connect. But there are some moms, and I think you know who you are, that I connected with in the community. And we may have never met. I never met Lorraine in person. And as the kids have gotten older, we have kind of communicated online a lot less. But I have basically watched these kids grow up. And Caleb, her son, was diagnosed just 1 month after Benny. Benny was diagnosed in December of 2006. Caleb was diagnosed, I think he's obviously a year or two older since he just graduated high school, but he was diagnosed in January of 2007. So we have been in this together for a long time. And I have watched her post these pictures of this fantastic kid and sharing so much information. And so I will link up her blog. She hasn't written in a while, but if you have a small child and you want to see a real go-getter of a kid who met Nick Jonas, they just did so many wonderful things. And she shared a lot of great information over the years that's still really relevant. And I'm talking too much because the reason I wanted to share all this is because at Caleb's graduation picture, he graduated as the valedictorian of his class. Holy cow. He's going to school for engineering. He is strongly considering biomedical to research type 1. I mean, just fantastic. So congratulations, Caleb. Congratulations, Lorraine, and to your whole family. He's got a brother and a sister, and she shared about them as well. I think it's really important to include the siblings too. But so many fabulous graduation stories this year. And if you've ever read This Is Caleb, or you want to look back on what blogging was all about back in the heyday of diabetes blogging, I will link that up as well. If you have a Tell Me Something Good story, feel free to reach out. I might stumble upon it on Facebook again, but you can always find me, Stacey, at diabetes-connections.com, or reach out in our Facebook group, Diabetes Connections, the group. Before I let you go, a couple of quick notes. The next couple of weeks are going to be really interesting on the show. Late June, early July, I have some late-breaking types of interviews, so stay tuned on social. I'm going to be posting in Diabetes Connections, the group, on Facebook with some behind-the-scenes stuff. I don't believe there's going to be any schedule disruptions, but you never know, so stay tuned on that. Some of the stuff is embargoed. I can't talk about it. It's technology news, as you can imagine. And I just want to get at you as quickly as possible. Podcasting is tough that way. It's not exactly an immediate medium, like radio. But I do my best, so I'll keep you posted on that. I will be at Friends for Life. That is July 7th through the 10th. And I'm always excited to go. And this year, more than ever, just because this is the first, for me, diabetes conference that I'm going to be going to in person since COVID. I cannot wait. And I'm doing a new presentation called Reframe Your Diabetes Parenting Brain. I will be sharing more about that in the weeks to come. But basically, I do this online anyway. I do this in my local group too. When somebody posts mom fail and talks about what they did and how they messed up their kids' diabetes, I try to reframe it and show them how they really did a good thing. I mean, I wrote a whole book about it, so why not? And then as I am taping this episode, we are getting Benny ready for his trip to Israel. I have talked about this on and off for the last year on this show. Many of you know how nervous I am about this. As you listen, as this episode goes live, he has gone. He is away. He has started his trip. And I don't know that I'm going to get too much sleep because while he goes away to camp every summer for a month, and while he's with fabulous people that I trust, he's not with us and he is very far away. So I'm probably not going to speak about it or post about it very much because many of you know me, I'm very superstitious, but I cannot wait till after when he is home and after I hug him, I will see if he wants to talk about how it went diabetes-wise, and hopefully we can report back. Oh my goodness. You guys know, I'm so nervous. I'm so excited for him, but this is really hard for me. All right. Thank you, as always, to my editor, John Buchanan from Audio Editing Solutions. Thank you so much for listening. We've got Diabetes Connections in the news every Wednesday, 4:30 live on Facebook, and then here on the podcast on Fridays. So hopefully I'll see you back here for that. Until then, be kind to yourself.
Diabetes Connections is a production of Stacey Simms Media. All rights reserved, all wrongs avenged.